Hello everyone, this is Kash Patel from Exeter University. In this video, I will show you how to collect saliva using saliva kit that we all using in good study. So there are two methods to collect saliva using this kit. The first is free spitting method or unassisted method, where individual would be spitting in the kit to collect the saliva. And this method would require cooperation from patients and therefore is suitable for patients who are more than 3 years of age or anyone who can follow the commands. This is a more preferred method of collecting saliva. The second method, which you can again use the same kit, is an assisted method of collecting saliva. This method is restricted for very young children under the age of 3 years, or patient who cannot follow the instruction. Okay, so now we are ready to collect saliva. So before we do that, there are two important things which you have to think about. First is to make sure that this tube remains upright to prevent this buffer coming out of the funnel. And the second is that patient mouth has to be clean. And we recommend that patient should not eat at least 30 minutes prior to saliva collection. If this is not possible, I would recommend that patient gargles 3 times using clean water. Wait for 2 minutes after that before starting a saliva collection. Let me show you how to do spitting method of saliva collection. And it is often suggested that patients should think about their favorite food in order to produce more saliva in their mouth. So essentially, you pull the saliva in your mouth and you simply spit in the funnel. You continue to do that till you reach to that arrow. As you can see, this method will require patient cooperation as well as to understand and follow the instruction, and therefore it is suitable for older children more than 3 years of age. Okay, so now we have finished collecting saliva. So the first of all, you have to make sure you fill the required amount of saliva, and this is extremely critical to get enough DNA for subsequent analysis. We want to collect saliva up to this arrow or up to 2 ml. Now what you would notice here is that saliva creates a foam. So what we want is that a level of liquid has to be at 2, not the upper level of foam, but actually the upper level of liquid has to reach to 2 ml or up to this arrow. And this is very important. So we are not including the level of foam, which is actually at 3 ml, but we are using the level of liquid as a marker how much saliva has been collected. So once you are happy that you have enough saliva, the next thing you would do is to remove this funnel, which you don't need it anymore, and you can throw it in a bin, and you put this cap back. Make sure you tightly close it to prevent any spillage. The next thing you have to do is to mix the buffer and saliva adequately, and this can be easily done by inverting tubes for about 5 times. Once the tube is mixed, you are happy with a required level of saliva. The next and more important part is to put a label on this tube. Now you have noticed that I haven't put the label before collecting saliva, and this is very important, is because as a best practice you should always put a label after collecting a sample, as we normally do in a blood sample, and we should follow the same principle here. So out of the 4 labels you find in the pack, you take the saliva sample, which it says on the label, take it from the label simply and simply put it on the tube. And that's it really. We have finished collecting saliva.